Cracked heels, a very common problem that we come across more in winters, but it goes on throughout the year and it affects all genders and all age groups, whether they are children, they are adults, or they are older people. And it not just causes embarrassment to look at such feet, but it is very painful and at times can lead to severe skin infections. So, why does this happen? Who are the people who are at risk of having these cracked heels? And what can you do at your end to remedify it? Let's talk about all this today. I am Dr. Mariam Ateek. Now, cracked heels occur usually in the dry and cold weather. When the air is very dry, the hydration in the air is very less. And our skin tends to get dry more easily. When the skin gets dry, its first protective mechanism is to start making it thick and rough, which results in the formation of corns, which are usually due to friction with the shoes or ill-fitting sandals that we wear in our feet. And then later, the calluses can form in the hands, in the feet, and later on they can get cracked and can develop fissures and skin infections. Now, why does this skin become so dry or it gets thickened? Many people, they've got such working activities that they have to stand or walk for prolonged periods of time. Then their shoes are not correct, they are ill-fitting, or they may be open sandals that they are wearing, or the soles of the shoes may be very thin. Then the posture that they use for standing may be improper, which results in more pressure being put on the heels of the feet. As a result, they get dry and they get cracked up. Then obesity, when you're overweight, God has provided the heel with a natural fat pad under it to bear the weight of the body. But if you are obese and overweight, this fat pad, it gets too much compressed and it spreads out on the sides, and then it results in cracking of the heels. Then if you are taking very long hot showers or you are sitting in the bathtubs for prolonged periods of time, then this can also over dry the skin and cause this problem. Then if your soaps or the washing liquids that you are using, if they are very harsh, they can strip the skin of its natural oils, again resulting in the problem of cracked heels. Sometimes people are taking all the measurements they need to take for these cracked heels and still the problem does not go. Then we have to think about other problems, other medical conditions that may be there which are not causing these cracked heels to heal. And what can those medical conditions be? Number one, simply diabetes mellitus. Diabetes, if the sugar level is uncontrolled, it can affect the nerves, it can cause neuropathies, and as a result, the perspiration does not occur in the skin and the skin gets excessively dry. Then there can be deficiencies of vitamins, especially vitamin B3, that is niacin, and vitamin B7. Or it can be vitamin C, vitamin E. All these deficiencies can result in the skin being dry and flaky, and there is easy probability of forming calluses and later on fissures and cracked heels. Then there can be mineral deficiencies, minerals like iron, like zinc, like calcium, or they can be the omega-3 fatty acids. Their deficiency can also get in the way of formation of cracked heels because they strip the oil from the natural skin and the skin gets excessively dry. Then there can be hormonal imbalances like hypothyroidism, in which the thyroid hormone is decreased and the skin gets typical leathery to look at and feel at. And this is one condition when you look at the skin like this that the doctor will ask you to get the thyroid hormone levels checked. In the same way, estrogen imbalance. It is a hormone present in the females, and this keeps the skin supple, smooth, fluffy, thick, and moist. So when the estrogen level is imbalanced, which may be later on as we age up, or in the normal people also due to some problem, if the estrogen level is not correct, it is imbalanced, it can result in dry skin and resulting in cracked heels. Then in old age, everything is working normally, but everything is working a little less. So the skin becomes thin and fragile, and there are less oils in the skin, and this can result in cracked heels. Then skin conditions. There are many skin conditions like dry skin, like eczemas, like psoriasis. There is a condition called juvenile plantar dermatosis, which especially affects the children, or they can be simple athlete's foot. That means fungal infections of the foot, the ringworm. They can all result in cracked heels. So now you know that which are the conditions that can cause it. Now, what is it that you have to do at your end? First of all, when the condition is not healing, by your home remedies, you have to consult the doctor so they can check for the underlying disease and give you treatments for those diseases. And on your part, you have to keep your feet moisturized. How do you do that? The easy way is soak your feet in water for 10 minutes, 20 minutes, and then rub them off with pumice stone. It will move away, it will sand off, it will peel off all the dry skin, all the calluses, and then within 10 minutes of washing, when the moisture is still in the skin, use the moisturizers, use the creams, use the emollients. The common oils that are present at home, like coconut oil, like olive oil, like mustard oil, almond oil, anything can be used. Then emollients are actually a bit thick. They are a mixture of water and oils, and they have become so thick that they have to be scooped out, like the Vaseline, like the petroleum jellies. Other than that also, there are many more moisturizing creams and lotions with nice fragrances that are available and that can be used. Then avoid activities that put too much of pressure and stress on the heels. Correct your posture. And once you have moisturized your feet nicely, then you should cover them up with socks. And the shoes that you are supposed to use should have good cushioned heels so that the pressure on them is not too much. Then of course, if you are overweight, you have to correct your weight by having the right kind of diet, which should include all the fruits, vegetables, whole grains, poultry, fish, so that all the oils can be supplemented, all the different vitamins and minerals can be obtained to keep your skin nice and soft. If there are any iron deficiency anemias, you will be advised medications and supplements for that. You have to drink your milk and you have to stay healthy. Then along with all these, you have to take the treatment if the cracks, they have developed infection and there is bleeding from them, if there is oozing from them, then the doctor is going to advise you the local antibiotic ointments which can be used to control the infection. Then the hard skin, the calluses, they are the superficial hardening of the skin as a protection so that it does not tear off. So these calluses can later on crack, and these calluses can easily be treated with creams that contain urea. Those creams can be used twice a day. So take care of all these things and keep your feet healthy because they have to bear the entire body's weight, and enjoy your winter season also, and take these precautions all through the year so that you have nice feet all along. They look pretty and you can enjoy your daily activities.